Welcome back, and in today's video we are going to discuss about the muscles of anterior compartment of the leg. And the muscles of anterior compartment of the leg are Tibialis anterior, Extensor Hallucis longus, Extensor Digitorum longus, and Peroneus Dericious. So these are the four muscles in the anterior compartment of leg, and there is an easy way to learn it. That is, all these muscles have a common point of origin either from tibia or fibula. Or more clearly, they all have the common point of origin as the interosseous membrane. And all of them are supplied by deep peroneal nerve. And all the muscles are acting as dorsiflexors of the foot. So these are the three common points of these muscles. That is, all the muscles are originating from the interosseous membrane, and all of them are supplied by the deep peroneal nerve, and all of them are dorsiflexors of the foot. Let us explore in detail about the anterior compartment. Yes, the muscles of anterior compartment of the leg. The first one is the tibialis anterior. Tibialis anterior. The second one is extensor hallucis longus. Extensor hallucis longus. You know that hallucis refers to the big toe. Pollicis refers to the thumb. Extensor digitorum longus. Digitorum refers to other toes. Okay, second, third, and fourth and fifth toes. Extensor digitorum longus. And the last muscle is Peroneus Dericious. Peroneus Dericious. So these are the four important muscles in the anterior compartment of the leg. And I told you these muscles have some common points. All these are originating from the interosseous membrane. All these are originating from the interosseous membrane, and all of them has deep peroneal nerve as the common nerve supply, and all of them act as dorsiflexors of the leg. All of them act as dorsiflexors of the leg. Now let us examine one by one the muscles. First muscle is tibialis anterior. What is the origin of this muscle? See here, just imagine this refers to tibialis. When there is tibialis, this muscle is originating from the tibia, right? We got the first point. Then we got the common point that these muscles are originating from the interosseous membrane. So you can just simply tell that it is arising from the interosseous membrane. Now, where from the tibia? Right? In tibia, you know that there is medial tibial condyle and lateral tibial condyle. But we know that in medial side, the leg has only anterior compartment, posterior compartment, and lateral. No medial compartment. No medial compartment. There are no muscles. So that straight away goes to the lateral compartment, lateral condyle. That goes to the lateral condyle. So this arises from the lateral condyle of the tibia. So this tibialis anterior muscle, the name tibialis itself refers to origin is from the tibia and from the interosseous membrane. So if you see the tibia, this arises from the lateral tibial condyle. Immediately below the tibial condyle, what you have? The shaft of the tibia, the lateral. So this arises from the lateral tibial condyle, and immediately below the shaft condyle, what do you have? The shaft of the tibia. Where in the shaft? Is it like extending throughout then? No, upper 2/3 of the shaft of the tibia. Upper 2/3 of the shaft of the tibia. So this is the origin. Clear? The name itself suggests it is from the tibia. I told you it can either arise from the tibia or from the fibula. Here, this is arising from the tibia. The name is a hint, and it arises from the lateral condyle. There is no muscle from the medial condyle, as there is no medial compartment muscles. Okay, and where from the shaft? After the lateral femoral condyle, lateral tibial condyle, you have the shaft of the tibia, upper 2/3 of the shaft of the tibia, and from the interosseous membrane. That's all about the origin of tibialis anterior. Tibialis anterior is a large muscle in the leg. Right, and it is easily palpable, especially in the soccer players, football players, etc. You can see that this muscle hypertrophied along with the calf muscle. You can easily palpate that one. and this is a multi-pennate structure muscle too. Now let us move on to the second muscle in this aspect, that is Extensor Hallucis longus. Extensor Hallucis longus. Extensor Hallucis longus. Okay, hallucis refers to the thumb. Okay, hallucis refers not to the thumb, to the big toe. Hallucis refers to the big toe. Pollicis refers to the thumb. Okay, now let us see where is the origin of this muscle. Right, we have a common point of origin, that is the interosseous membrane. That is the interosseous membrane. Right, now the tibia, already the tibialis anterior took it. Now we have only the fibula. Right, it is arising from the fibula. Where from the fibula? Head of the fibula? No, it is arising from the shaft of the tibia, fibula. It is arising from the shaft of the fibula. Medial surface of shaft of the tibia, shaft of the fibula. Medial surface of the shaft of the fibula, and more clearly middle 2/3, middle 2/4 of the medial surface of the shaft of the fibula. Only just you have to remember this. This also you can correlate and study. That is, it is arising from the, already tibia is over. Now you have only fibula left over. So it is arising from the fibula. Where from the fibula? Medial surface of the shaft of the fibula. You know that tibia, the lateral surface is occupied. So here what we have, the medial surface of the fibula. So it will be arising from the medial surface of the fibula, not entirely. Upper 2/4, middle 2/4 of the medial surface of the shaft of the fibula. That's origin of Extensor Hallucis longus muscle. Right? And there is an easy word to remember this muscle. You can remember PET. Okay, PET. P stands for Peroneus longus, Peroneus Dericious. E stands for Extensor Hallucis longus, Extensor Digitorum longus, and T stands for Tibialis anterior. If you remember this hint, you can remember the muscles. If you have any more interesting mnemonics or shortcuts, just remember, just ping me on the comment box so that I can know about that. Right? And now let us move on to the third muscle, and that muscle is known as the Extensor Digitorum longus. Extensor Digitorum longus. Digitorum means it is supplying the all the digits except the big toe. Okay, Extensor Digitorum longus. Now, where is its origin? We have the common point of origin, that is the interosseous membrane. We have the common point of origin, that is the interosseous membrane. Now, fibula, tibia is over. Now let us again go back to tibia and fibula. So this muscle has origin from the tibia. This muscle has origin from the tibia, that is the lateral tibial condyle. See that you can remember this. This and the tibialis anterior is originating from the lateral tibial condyle. Lateral tibial condyle, and from the fibula. And from the fibula. Right? Where from the fibula? Where was the Extensor Hallucis longus originating? Shaft of the fibula. Same shaft of fibula. Upper half and anterior 1/2 and anterior half of middle 2/3 of shaft of the fibula, middle 2/4 of the shaft of the fibula. So you need not remember all this. You just remember that the shaft of the fibula, middle 2/4 of the shaft of the fibula. Or if you can, it is well good, upper half and anterior half of the middle 2/3 or middle 2/4 of the shaft of the fibula. Of course, you have to remember one or two things. That's how to do it. Other things we can correlate and study. That is, it has an origin from the interosseous membrane, it has an origin from the tibia, it has an origin from the fibula. Origin from the tibia is same as the lateral tibial condyle for the tibialis anterior muscle. And the last muscle in this group, that is your Peroneus Dericious muscle. And the last muscle in this group is the Peroneus Dericious muscle. Peroneus Dericious muscle. This muscle have the common point of origin. What is that? Simply you can guess it. Interosseous membrane. Very good. Interosseous membrane. Right? And from where? This is a muscle that is seen in the lower end. Very in the lower end it is seen. So it is seen in the lower 1/4 of the shaft of fibula. Lower 1/4 of the shaft of the fibula. Medial surface. right? So this is a very small muscle arising from the lowermost part, lower 1/4 of the shaft of the fibula. So what is the origin of this muscle? It is a lower 1/4 of the shaft of the fibula from the medial surface of the shaft of the fibula, right? This is about the origin. What is it? Is it easy? Yes, of course it is easy, because all muscle has interosseous membrane as the origin. Then the first muscle is tibialis anterior. It is arising from the tibia. The second muscle, and immediately below the tibia, that is a tibial shaft. Then second muscle goes for fibula. Third muscle again comes for tibia and fibula, and fourth muscle again goes for fibula. There is an order. And how to remember the name? PET, P for Peroneus Dericious, E for Extensor Hallucis Longus, Extensor Digitorum Longus, and T for Tibialis anterior. Now let us see the insertion of this muscle. Is it easy to remember the insertion of this muscle? The first muscle, the tibialis anterior, okay? The first muscle is tibialis anterior, and it is inserted into medial cuneiform bone. One of the peculiarity of all these muscles are they are inserted into the dorsum of the foot. They are inserted into the foot. So you can remember foot and find out where in the foot. Here it is in the medial cuneiform bone. Medial cuneiform bone, alright? Medial cuneiform bone. And distal phalanx of big toe. Distal phalanx of the big toe. So this is the insertion of tibialis anterior muscle. Where is it actually? It is inserted in the medial cuneiform bone and distal phalanx of the big toe. And the next muscle over there is Extensor Hallucis Longus. I told you the name itself give you the hint. Hallucis means it is attached to the big toe. So definitely it has its insertion in the big toe. So we got the first answer, that is the big toe. Where in the big toe? I told you all these muscles are seen in the dorsum of the foot. So dorsal surface of base of big toe. Base of distal phalanx of big toe. Distal phalanx of big toe. So this is the insertion. Simply you can tell it is inserted into the big toe, and more clearly dorsal surface of the base of distal phalanx of the big toe. Big toe has a distal and proximal and distal phalanx, and in the distal phalanx this is inserted because this is the chief extensor of the big toe. Right? So this is the insertion of Extensor Hallucis Longus. And now let us move on to the insertion of the next extensor, that is Extensor Digitorum Longus. Extensor Digitorum Longus. Extensor Digitorum Longus, the name itself gives you the answer. It is inserted into the digits. Yes, it is inserted into second, third, fourth, and fifth digits. Right? Second, third, it is inserted into second, third, fourth, and fifth digits. Right? That is the insertion. That is, it is inserted into second, third, and fourth, and fifth digits. Where in these digits? The base of, yes, always it is inserted in the base. Base of distal and middle phalanx. Base of distal and middle phalanx of the excuse me, base of distal and middle phalanx of the digits, second to fifth digits. See how easy it is. This muscle is inserted into the base of distal and middle phalanx of the digits. First muscle over here is the Peroneus Dericious. Where is it inserted? You know that it is in the dorsal surface. Yes, it is in the dorsal surface. Most of them are inserted in the base. Now, base of what? Base of the fifth metatarsal bone. So this muscle is inserted into the base of the fifth metatarsal bone. Metatarsal bone. This is seen lateralmost to your foot. If you see, this is the foot, this is the medial aspect, the lateralmost. Corresponding to your fifth digit, you have your Peroneus Dericious, that is it attached to the fifth metatarsal bone, the base of the fifth metatarsal bone. That's all about the origin and insertion of this muscle. Now next one is the nerve supply, and you know the nerve supply, what is the nerve supply? Deep Peroneal nerve. So the nerve supply is deep peroneal nerve. And thus we finish on to the action. Let us move on to the action of this muscle, which is of course very easy as we studied all this. That is the action. Tibialis anterior, you know the action. What is the common action? That is the dorsiflexion. The common action is the dorsiflexion. So if you imagine the foot, this movement, that is the dorsiflexion. Now the extensor hallucis longus, extensor digitorum longus, Peroneus Dericious. All of this has common action as the dorsiflexion. So all of this has a common action as the dorsiflexion. But tibialis anterior is having other function. Dorsiflexion as well as it is an inverter of the foot. It is an inverter of the foot. Dorsiflexion and the inverter of the foot. This muscle supports the medial longitudinal arch. It supports the medial longitudinal arch. You know that there is medial and lateral longitudinal arch of the foot. Okay, you have the foot and you have a shape like this. This is a longitudinal arch, and this muscle insert into the or supports the medial longitudinal arch. And this is the muscle that help in walking straight on a uneven ground by keeping the tibia and foot straight. So this is a muscle that helps in keeping your foot straight in an uneven ground. That is your tibialis anterior. For function, the dorsiflexion, the inversion or inverter, the help on supports the medial longitudinal arch and help in walking in uneven terrain. And then the extensor hallucis longus. Where is it inserted? Hallucis, the big toe. This first function is dorsiflexion. The second function is extension of your big toe. Yes, that's easy. Extension of your big toe. Extension of MTP and distal interphalangeal joint of your big toe. If you don't want to remember that, just remember extension of your big toe. Next muscle, extensor digitorum longus. The function is extension. It is attached to the digits. So this muscle is attached to the digits. So the function is extension of second, third, fourth and fifth digits. Extension of your digits at the interphalangeal joint and metatarsal joint, MTP joint and the interphalangeal joint. And finally, Peroneus Dericious. The function is dorsiflexion. Along with that, this is the everter. This is the muscle that produces eversion. So this is the muscle that produces eversion. That is a Peroneus Dericious is an everter. So the functions are the tibialis anterior is a dorsiflexor, inverter, extensor hallucis longus, dorsiflexor, extension of the big toe at metatarsophalangeal joint and the interphalangeal joint, proximal distal interphalangeal joint. Extensor digitorum longus, dorsiflexion and extension of your digits, and Peroneus Dericious is an everter and the dorsiflexor. That's all about this muscle. And now we have a small muscle in this area which is not in the anterior compartment but it is in the dorsum of the foot. You know that this is the foot and this is the tibia. Imagine this is the tibia and this is the foot. Here you have a muscle. That muscle has a common name like this. That is the extensor digitorum brevis. So we will discuss here this muscle. Extensor digitorum brevis. Yes. Extensor hallucis longus, extensor digitorum longus, extensor digitorum brevis. 3E in the pet. Okay. Extensor digitorum brevis. This muscle originates from the calcaneum. This muscle originates from the anterior surface of the calcaneum. This muscle originates from the calcaneum. And this muscle is inserted. Where is it inserted? This muscle is inserted. That muscle is the extensor digitorum brevis. Where is it originating? It is originating from the foot. Okay, that is from the calcaneum, superior surface of the calcaneum. Where is it inserted? It is inserted into the digits, digitorum digits. Okay, second, third, fourth, fifth digits. How is it is inserted? This muscle along with the other, the digitorum muscle, that is the extensor digitorum longus. Both these muscles comes together as a common tendon and this insert into the each of the digits and that insert into the each of the digits. Second, third and fourth digits, not the fifth digit. Second, third and fourth digits. And the first tendon of this muscle is known as extensor hallucis brevis, that is inserted into your big toe. So extensor digitorum longus muscle is inserted, is having 4 tendons. The first tendon of this muscle is known as extensor hallucis brevis, that is inserted into your big toe. The other tendon, second, third and fourth tendons are attached to or comes together with the extensor digitorum longus tendon and is inserted into the base of the base of the second, third and fourth digits, and that forms the extensor expansion of your foot, and that forms a common structure known as dorsal extensor expansion of the foot. That's all about the muscles of the anterior compartment of the leg and dorsum of the foot. And we have a clinical condition here known as the foot drop. That is, the muscles that everter, the dorsiflexor muscles are weak. When the dorsiflexor muscles are paralyzed, the foot goes for foot drop. This goes for drop. Only the plantar plexus gets activated, and that condition is known as foot drop, and that is due to the weakness of your dorsiflexors. And where is the damage? It's usually due to the damage to the common peroneal nerve, such as leprosy, neuritis, or a trauma, or a central nervous system problems like a stroke, etc. So that causes the foot drop, weakness of the tibialis anterior and other dorsiflexors of the foot. That's all about this compartment, that is the anterior compartment of the leg, and of course the dorsum of the foot. Feel the video is simple and you can understand easily. Don't forget to click the like button and kindly subscribe to my channel.